So let's see here. One good vial, two good vials. Okay, three good vials. Okay, that's all I need. Give me a quick second. Okay, so I've got your blood samples and I'm going to keep them and I'm going to analyze. I am very concerned because your blood is how should I say, it is not red. It is showing kind of like a magenta kind of greenish color, which I'm extremely concerned. So I will run this through the blood analysis for the portable blood analysis later after the surgery, and I will see what's wrong. So this is the fun part. This is where we begin the abdominal surgery. Are you ready, sir? Okay, Sir FG, what I need you to do is place this oxygen mask on top of Mr. Gilmore's face, and I'm going to start pumping deep anesthesia so that he can start falling asleep. All right, perfect. Miss Ellie did sanitize them before she left, so these are definitely ready. Okay, Mr. Gilmore, I'm going to start the machine and it's going to start pumping anesthesia into the mask. You just got to breathe in and out slowly, okay? And then you will soon knock out. Okay, good, good. Here's what I will begin. I will make a 10 millimeter incision in his left abdominal cavity, and then I will open it up further using a clamp and using um, my retractors, and I will see what's wrong with with his stomach. Here I go. Okay. Dr. Blades don't run. If you are available, can you please come to RT, please? I am in need of assistance. All right, Mr. Tokugawa, what I'm gonna do is, okay, I'm gonna make the incision, and I want you to wipe any excess blood that's falling off from the left abdominal cavity. Okay. So the blood's already leaking green, magenta-ish colored fluid. This isn't good. Okay, so here's what I'm gonna do. I'm gonna take the scalpel. No, not a I'm gonna take the clamp, and I'm gonna take the retractors. I'm gonna open them up a lot more, and I'm gonna see what's inside of his. I'm gonna see what's inside of his abdomen, and I'm going to enter subxiphoid. Okay, Dr. Blades, I am glad that you're here. I'm in the middle of an abdominal surgery, which will soon turn into an anal surgery on Mr. Gilmore. And I am working on your assistant because he has ingested glue and he hasn't been able to excrete his feces for 3 days. I need your help. Okay, here's what I need you to do. I need you to take the retractor and I need you to put it in his left abdominal cavity while I'm using the clamp. And I need you to open. And I need you to, when I say open, I need you to use that retractor to open it at least 6 inches wide, so I can take a better look at his left. I can look better look at his stomach and then what's inside of his abdomen, because his stomach, it's already leaking green and magenta liquid. I'm assuming that's his blood. Due to the crayons that he ingested, it literally has entered into his bloodstream, causing oil toxins, and I'm gonna have to drain that as well. So I need you to open the what's it called? The incision that I made by 6 inches using the surgical retractor on the left abdominal part of his cavity. Okay. Now that you have opened his left cavity wide, um, oh my God, sir, Dr. Blades, if you're going to puke, please away from the patient. You almost got puke inside of his cavity. Oh boy. Okay, this is the fun part. So, I can see there's a lot of foreign, not I'd say objects, foreign anomalies in his abdomen. And here's what I'm gonna do. I am going to drain his not blood, but I'm going to drain a little bit of his amniotic fluid here, and I'm going to run it in through. I'm going to run it through through my cleansing machine here, and I'm going to recycle it and turn it into healthy amniotic fluid, which will clean the blood. Unfortunately, because of what Gilmore swallowed and because of what he did with crayons and glue, it has made a simulation of amniotic fluid. As you could see there, it's you look into his little left, and if you look into his abdomen using the left incision that I made, you could see that there is sticky and wet amniotic fluid. That is not amniotic fluid. That is glue and crayons inside of his abdomen. Yeah, so I'm gonna be draining that. I'm gonna call it false amniotic fluid. So here's what I'm gonna do. I'm gonna drain it, and then I'm going to replace um, the drain fluids with some fresh blood. So give me a quick second here while I connect the tubes. Mr. Money, it's good to see you here. I'm in the middle of surgery treating Happy Gilmore. I know I'm only part of the psych unit, but I do have surgical tools and surgical experience from HP. I am trying to help Mr. Gilmore here because he ate crayons, swallowed glue, and has not been able to extricate his feces for 3 days. Okay, I'm gonna drain the tube. I'm gonna drain the abdomen now. you're going to see this sticky white liquid go into the machine and go into the bedpan and into the bowl. It's going to look and it's going to smell very bad. I'm going to tell you this right now. It's going to smell as if Shrek shat in front of you and put seasonings on his poo. Oh, there it is. As you can see, the white fake amniotic fluid like stuff is going through the tubes and into the bedpan and into that little bowl. Isn't it wonderful? Oh dear Lord, it smells. Oh dear Lord, it smells. It smells bad, but this is so cool. Okay. Okay, here's what we're gonna do. Now that I'm gonna remove the tubes, and then we're gonna start looking into the abdomen. As you can see, his blood is already kind of like a greenish magenta, which means it is mixed with the intoxication of the oils that the crayons that he ate. So here's what we're gonna do. I'm gonna look around in the abdomen, and I'm gonna see crayon parts that have not fully dissolved and it's still leaking oil. So let me see. Let me get my tweezers here, and then let me disconnect the tube. And if you can, Sir Dr. Blades, you can use your light and kind of just like skim around to see what you can find as well. Any foreign objects that you see inside of his abdomen, please remove that and put it in the bedpan. We can't have anything inside of his abdomen. Otherwise, before we even get to the anal area, he's not gonna have any. His body's not gonna have any digestive freedom. Okay. Oh God, that smells. Um, I could see here that his blood is still leaking magenta greenish liquid. So, oh no. Okay. Um, Dr. Blades, can you please hand me 10 cc's um of adenosine? Adenosine will slow, but then kickstart his heart again. Quickly, please. Okay. Okay, that's fine. If if you're supposed to play, just let you know. Just if you just ask her, and you actually don't even ask her. You can go. I can do the surgery up here. I'll be fine. The chief is here to help me. Um, I just need to clear out the Gee, he needs. Okay, okay, his pulse is increasing. Got it. Okay. Um, Bla Dr. Blades, can you please return the ketamine to the medical room, please? Thank you. Okay, let me see here. One, two, three, four. Oh, that's in. Okay, hold on. 5, 10, 15, 20, 25, 30, 1, 32, 33, 45, 46, 47, 49, 40. Okay, I counted 40 crayon pieces. Oh, dear Lord. Okay, so I'm now going to use saline to flush out the blood. It's going to be okay. It's going to be a little messy, but it's going to be just like a sink. It's going to clear out until this greenish magenta is back again to red. So while it's flushing, I'm going to get started on preparing to close his abdomen, and we'll get started with the anal area. Okay, okay. So lovely. That greenish magenta color is now turning a lot more like blood red. Oh, it's lovely, 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 lovely. Okay. It's gonna just a minute for it to flush out, and then I'm gonna remove the retractor, remove the clamp, place it back, and then suture him up. Okay. Perfect. Oh God, he's waking up. Let me add a little bit more morphine. Let me add a little bit more anesthesia so he can stay asleep. Okay, there we go. That should be taking effect. Beautiful. Now his blood is blood red. It's fully drained. Beautiful, beautiful. Now time for me to suture him up.
Meow, 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 meow. What's up, the king?
Hold on, King. I'm in the middle of surgery right now on Mr. Gilmore. Don't touch anything. Okay. Actually, matter of fact, do me a favor and hand me those medical gauze, please.
Medical what?
Hand me the medical gauze.
Use the medical dogs?
It's fine. It's fine. I got it. I got it. Okay. I'm gonna wipe off the excess blood here. Okay. So he should be fine. He just needs a little bit of rest. There's nothing more poisonous in his cavity. Everything that he ate and swallowed, including the glue, the crayons, and the balloon animals, should be on the bedpan. And now to remove his obstruction in his anal area. So I'm going to be performing an anal excavation. So Mr. Tokugawa, can you please flip him over very carefully, not to upset the stitchings that I've already done? I will start doing an anal excavation. And yes, Kingston, I was part I was part EMS. I was a specialist doctor. I left, but I do have experience in surgery, psychology, and general procedures. So he is fine. I am also the head doctor for the psychology unit. Okay.
DFG. FG had poisoned me.
I will get to you in a little bit, sir. I will check your bloodstream and I will grab some blood samples. Just give me a quick second. I need to finish his anal excavation first. Okay, Mr. Totogawa, here's what we're going to do. I am going to open his anal area by taking the scalpel and cutting the middle of the anal hole, and I'm going to use the retractors to expand his hole and drain anything that is in there that is causing his blockage. So here's what I'm going to do. I'm going to begin by making a 4 millimeter cut into his anal hole. So hold the body still, please.
Uh, this is kind of crazy.
Oh, trust me, I've been wanting to do this on Gilmore because he's been eating too many stuff and now he just can't poop. So now I have to do this. Okay, where's the retractor? There it is.
I think you need to go back to EMS. This is the army, yo.
Yes, and I am a certified Army doctor as well. I am the doctor for on base procedures, whether it be psychological or physical.
Oh, nice.
Which saying, okay, hold on. Sir FG, make sure to hold the body still. I'm gonna be putting it inside of his anal hole now, and I'm gonna open it wider. If you want to schedule a psychological appointment with me via session, or if you want psychological guidance or counseling, you can also do that with me as well.
Hey,
Oh, okay.
FG, Ma'am Susan.
Yes, 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 yes. I see the feces. That's fine. I will clean it up later. But that's glad. I'm glad feces was able to come through, and it looks diarific, which means um he is
Yes,
holding a lot
sir.
he's holding a lot of feces in there, and it's probably because of the glue that was stuck in his anal cavity. So I am gonna drain that, and I'm gonna have to warn you right now. There's going to be an excess amount of poop that will flow from his butt, but that is okay. That is what we want.
I think it's gonna be right at you.
That's fine. That's fine. I'm used to this kind of things. It's fine.
Make sure you have a mask on, all right? A mask and a face mask for sure.
I still got to see what's making the blockage because I can see from the little hole from the hole here there is glue blockage in his anal cavity, which is causing it's like a basically a dam. The glue hardened and it's causing blockage in his anal area. So I'm gonna have to use my scalpel, cut open the blockage, drain it, and then wait for the waterworks to come. Yep, it's basically a clog, a very deep glue clog that has happened in his ass. So, okay, so, okay, so I can see the hardened glue right there. Don't feel bad for him. He's the one who ate all this stuff. Okay, so I can see the glue right there. I'm gonna use my scalpel to slowly make an incision and cut the glue barrier in half. Hold on, give me a second. Okay, this should be fine. This is gonna be easy. So, okay, okay. Ooh, okay, okay, okay. It's starting to fall in. So whatever poop or liquids comes out, do not stop it from falling. I'm going to clear the rest of the blockage by using my forceps to get the hardened glue and just let it flow. Let everything flow.
Oh shit! I saw the crawdad coming out that shit.
Okay. 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 I've got them and I'm going to place them. Oh, dear Lord. It's all over my uniform. Um, Okay, Mr. FG, sir, if you can, please clean up the feces around the bedpan and around the floor. Everything is spraying out right now, so just clean it up, and I am going to get the pieces off here, and I'm going to, oh dear Lord, it smells horrible. I'm going to make sure to clean the surgical table too, please. I'm going to remove all the excess blockage. Okay, okay, it's all removed. Now all we just need to do is just let him just poop it out. Just let him poop it out. He has been holding this for 3 days. He just needs to let it out. Oh, Lord, it got on the walls and on the ceiling. Oh, my Lord. Okay. Okay. Looks like everything is out. Ah, okay, there's my vest. There's my vest. There's my shoes. And there's my pelts. Oh, there we go. At least okay. No, no, no. I got this. I got this. Okay. Okay. All the excess seems to be out. All the drainage seems to be fine. Um, Sir Tokugawa, clean up the surgical bed, please, and clean up his anal area. I'm gonna begin stitching him back. Kingston, why would you do that? That wasn't okay. Before you spawn, Happy, and before you spawn, let me finish your stitching in your butt, and then you can spawn in the clinic, and you should be fine.